Hi, my name's Jenny Crowe and I'm the clinical matron for Ward C2 in the North Hampshire Hospital Basingstoke. I'd like to tell you about some exciting opportunities we've got for Band 5 nurses at any stage in their career. First of all, one of our consultants, Faheez Mohammed, would like to tell you about our service.
Thank you, Jenny. I'm Faheez Mohammed. I'm one of the consultant surgeons who works on C2. Basingstoke is one of the two national centres that treats pseudomyxoma peritoneae, which is a very rare cancer of the appendix. Essentially, it's what we call a peritoneal malignancy, so it's a cancer that's spread to the peritoneal surfaces. And like colorectal cancer and mesothelioma, the approach to treating it is a surgical one with fairly extensive surgery, combined with hot chemotherapy, essentially hypothermic intraperitoneal chemotherapy, or HIPEC. Now, the other centre in the country that treats appendix tumours is Manchester, and between us we see most of the cases within this country and cases from abroad as well. We are the busiest peritoneal malignancy centre in the world at the moment, and we're doing quite a large volume of cases, but it means that we see a wide range of both tumours, but also the patients that we look after have had very extensive surgery with the chemotherapy, which means it's not really your run-of-the-mill general surgical ward. There are a lot of opportunities for teaching, for training, for learning, and certainly we have people visiting from all over the world. So a job on the C2 at Hampshire hospitals is the perfect stepping stone into the next stage of your career.
On C2, we are truly multidisciplinary. We have a wide variety of specialist nurses who can support your professional development and expand your clinical skills. Our junior sister Hannah is going to tell you a little bit more about that.
Hi, my name's Hannah and I'm the Deputy Sister here on Ward C2. Working on a specialist ward like C2 offers lots of learning progression with clinical skills. This gives you the opportunity to learn and develop and look after the acute patient group. The training that we have here to offer on C2 is brilliant. So you can go on your chemotherapy course and learn how to administer it firsthand on the ward. You can do your central line training, your PCA training and epidural training, and become competent in all these skills. Any new member of staff are so well supported on the ward. We have a team of experienced nurses that will work alongside you, and we've also got experienced clinical nurse specialists who will work with you to build your confidence and give you guidance.
So some other great reasons for joining us are: one, flexible working. We offer long days, short shifts, predominantly nights if that's what you like. Second reason, you're going to get the opportunity to take part in international conferences. Last one was in Washington, the next one's in Paris. You can take part in current up-to-date research, which we do on the ward. We have a research team working with us. You've got the opportunity to present at those conferences with posters if you like, or the opportunity just to go along and learn. The best bit for me though is that working on this ward with this team, you are able to provide the highest standards of patient care. It's the reason we're all here, and it's what we want to go home at the end of the day feeling we've provided. But I don't want you to take my word for it. I'd like you to hear from one of my patients, so I'd like you to hear from Stephen.
Hello there. Yeah, I've been here about 8 weeks, and what I would like to say about this ward, it very much feels like one-to-one nursing. I feel the nurses have really got to know me and I've got to know them. They know my likes and my dislikes, and I do feel it really is an inclusive team. I've been consulted about all my medications and treatments all the way through, which I find very comforting. So yeah, what can I say? It's a wonderful ward to be in.
So thank you, Stephen. I'd also like you to hear from Nikki. She's one of our second year student nurses from the University of Southampton who's with us on placement at the moment.
Hi, my name is Nikki. I am currently a second year student studying at Southampton University, and I am 6 weeks into my 8-week placement here on C2. Every placement is said to be a positive learning experience, and all I can say about C2 is it has simply been outstanding. The dedication, care, commitment, support that I have received whilst here on placement has enhanced my learning and been immeasurable. C2 has shown and taught me what specialist, exceptional, individual and holistic patient care should be like in practice. I hope one day that I will return here as a qualified staff nurse, because I just love it and I love what their ethos, and I love what they do.